Welcome to the University of Calgary Health Sciences Library tutorials. This session will introduce you to using Pubmed clinical queries. When searching for literature, first assess what the purpose of your search is. Are you conducting a comprehensive literature search to see the breadth and depth of the information available on a specific topic? Or do you simply need some higher-level evidence at the point of need? A comprehensive literature search is best conducted through a classic database search in products like Pubmed or Medline. All searches aim to have a best balance of precision and recall, but a comprehensive search errs on the side of increasing recall. For finding answers fast, there is a section in Pubmed called Clinical Queries. It limits your results to clinical research areas only and thus increases the precision or specificity of results, but you won't retrieve the full spectrum of material available on a subject matter. The main objective of most searches is to get full text access to the scholarly literature. Pubmed is freely available for anyone to search. However, you will be prompted to pay for any proprietary material. By using Pubmed through the University of Calgary, you are authenticated through to the licensed material we provide for students, staff, and faculty. Be sure to bookmark library.ucalgary.ca/HSL for an easy way in, and select the yellow and red Find It SFX button for full text. A search done in Pubmed Clinical Queries has filters running in the background. For each category, you have the option to select broad or narrow. Take a look at the shift in sensitivity and specificity. The Pubmed equivalent column shows you what other filters are being applied, such as publication types and specific terminology. Here are some tips for using clinical queries. Always be sure to use Pubmed through the University of Calgary Library. Be sure to keep your search simple, but try acronyms and quotation marks around phrases. Change the category and choose broad or narrow, and note the differences in results retrieved. When you get some results, look at the page as 3 columns: clinical study categories, systematic reviews, and medical genetics. So let's try it. Let's try clinical queries with the following example. Does hypothermic intraperitoneal chemotherapy, also known as HIPEC, affect prognostic outcomes in patients with gastric cancer? For ease of searching, form your PICO by identifying your patient population or problem, your intervention, any comparison, and the outcome. A PICO is a way to identify searchable concepts. As always, the first thing that you need to do is point your browser to library.ucalgary.ca/HSL. That will bring you to the Health Sciences Library homepage. Under Major Resources, select Pubmed. Now, normally when you use Pubmed, you put your search terms into the search box and select Search. However, we need to go into the middle of the page, and under Pubmed Tools, you will find Clinical Queries. If you want to read more about the filter information, simply select Filter Information and you can explore this chart further. So let's pop in our search terms. Let's put in gastric cancer, hypothermic intraperitoneal, chemotherapy. And then we'll select Search. Make sure that you change the category. We outlined earlier in our question that this was actually a prognostics question, and we're going to keep our scope broad, but note the difference if we went narrow, 88 to 48. Take a look at the 3 columns and note the manageable amount of papers that have been returned. For example, there's only 7 systematic reviews, which makes browsing really easy. Let's select the first one. So right away, we get the abstract with the background, objectives, methods, and results. And to get full text, look for that gold and red Find It SFX button to click through for your electronic copy. So here you can select full text available for the electronic copy. This concludes the tutorial on using Pubmed clinical queries. For more information, or if you have any questions, please do not hesitate to contact us at library.ucalgary.ca/hsl.